test coming up on bipolar disorder. Here's 29 questions so you can ace that test. Ready? Let's learn psych fast. Question 1. Which statement by the patient would indicate the need for additional education regarding the prescribed lithium treatment regimen? A. I will restrict my daily salt intake. B. I will take my medication with food. C. I will have my blood drawn on schedule. D. I will drink 8 to 12 glasses of liquid daily. The answer is A. I will restrict my daily salt intake. Why? Well, a patient taking lithium must maintain a normal sodium intake or risk symptoms of lithium toxicity. The patient should have 2 to 3 liters of fluid daily, and taking lithium with food minimizes GI side effects. Regular monitoring of the lithium levels is important to prevent toxicity. Question 2. You're making your rounds at the hospital and a nurse comes to tell you that she noticed a newly admitted manic patient is demonstrating grandiosity. Which statement would be most consistent with this symptom? A. I can't do anything anymore. B. I'm the world's most astute financier. C. I cannot understand why my wife is upset that I'm overspending. D. I cannot understand where all the money in our family goes. The answer is B. I'm the world's most astute financier. An individual who is demonstrating grandiosity has an exaggerated view of his abilities. The other options are more moderate statements and lack the elements of exaggeration. Question 3. A 45-year-old man with a long history of bipolar disorder has been stable on maintenance lithium treatment for the past year. Which of the following statements best describes the current working hypothesis about the molecular mechanisms of action of lithium? A. Increased synthesis of adenyl cyclase. B. Increased synthesis of inositol monophosphatase. C. Increased serotonin reuptake into serotonergic terminals. Or D. Upregulation of beta adrenergic receptors. E. Decreased synthesis of IP3 and DAG. Or F. Increased glutamatergic activity. The answer is E. Decreased synthesis of IP3 and DAG. You can read below to find out a little bit more about the enzymatic activities of how lithium works. The questions will start easy and then get progressively harder. Good luck! The psychiatric mental health nurse practitioner knows the base of dysthymia to be on A. Typically has an acute onset. B. Involves delusional thinking. C. Is a chronic low-level depression. D. Does not include SI. C. Dysthymia is identified as a chronic low-level depression, frequently lasting over a period of several years without remitting. Dysthymia has a slow, insidious onset. Delusional thinking is not a common manifestation of dysthymia, and SI thoughts are seen among dysthymic patients. Question 5. An inappropriately dressed patient has not slept for 3 days while making excessive, expensive long-distance phone calls. When the patient can be heard singing loudly in the examining room, you advise the nurse to make the initial plans that focus on A. Assessing need for food, liquids, and rest. B. Setting strict limits on dress and behavior. C. Conducting an in-depth SI assessment. D. Obtaining a complete psychosocial assessment. The answer is A. Patients with mania frequently ignore their basic physiological needs, as evidenced by not sleeping for 3 days, thus making these assessments a priority. Limits, although appropriate to consider, are not the priority. The manic state precludes a thorough assessment initially. SI assessments is not a priority at this time, but reckless behavior could result in personal injury. Question 6. The PMHNP would evaluate the patient education regarding lithium therapy for an individual with bipolar disorder as effective if the patient states A. I can stop my lithium when I feel better. B. I can continue with my diuretic and cardiac medications. C. I will probably need to take the lithium for the rest of my life. D. I will taper my lithium when a therapeutic serum level is achieved. The answer is C. Most patients with bipolar disorder require long-term maintenance on lithium or other anti-manic medications. Patients should never stop medication without consulting the physician or NP. When a therapeutic level is achieved, the patient will continue on maintenance dose of lithium. Diuretics are contraindicated for patients on lithium. Question 7. A patient has been taking lithium carbonate 300 milligram TID, comes to the outpatient department with a list of medication he is taking. Which of the medications on the list would require reevaluation of lithium dosing? A. Hydrodiurol. B. Navane, BID. C. Ativan at bedtime. Or D. Cefepide daily. A. Diuretics alter fluid and electrolyte balance, increasing risk for lithium toxicity. Therefore, hydrodiurol is correct. Antipsychotic medications are frequently prescribed concurrently with lithium to manage acute symptoms of mania. So, no reevaluation of lithium dose is necessary for Navane. However, anxiolytic drugs, they are not contraindicated for concurrent use of lithium use either. So, no lithium dose reevaluation is necessary for Ativan. Antibiotics do not alter fluid and electrolyte balance, so readjustment of lithium dose is not required for the antibiotic. Question 8. Which intervention is most therapeutic when managing the aggressive, disruptive behaviors of a manic patient whose attempts to control the milieu has been rejected by the other patients? A. Advise the patient to accept the wishes of the group. B. Suggesting that the patient either quiet down or leave the room. C. Accompany the patient to a quieter part of the unit. Or D. Ignore the patient's outbursts because they are surely related to the mania. The answer is C. Escorting the patient to a less stimulating environment will assist a patient to remain in control of behavior. It is unlikely that the patient would respond to verbal suggestions to leave the area unaccompanied or accept the group wishes, and would likely see the suggestions as a threat to further escalate the impending loss of control. The behavior cannot be ignored since it will likely lead to an escalation of the mania. Question 9. A patient with bipolar disorder reveals to you that she may be 4 weeks pregnant. Which action should you take? A. Should you order a pregnancy test and discontinue lithium? Or B. Educate the patient to the risks to the fetus as a result of exposure to lithium in her blood? C. Increase the lithium dose for better symptom control? Or D. Remind the patient that the barrier birth control methods should be used to prevent pregnancy during lithium therapy? The answer is A. First, you have to learn whether the patient is, in fact, pregnant. Lithium ingested by the mother can cause fetal damage. Also, it should be discontinued, not increased, if the pregnancy is actually confirmed. It's premature to discuss fetal malformations before the pregnancy is even confirmed. So, options B and C are inappropriate and actually harmful. Birth control information, no value unless the pregnancy test is negative in your future planning. Question 10. Which measure would be relevant to protecting the physiological integrity of a patient during a manic episode when marked hyperactivity is present? Is it A, have the milieu staff provide appropriate attire for patients to wear? B, set firm limits on behavior injuries to others? C, enter an order for daily weight? D, use genuineness to develop a therapeutic alliance with the patient? The answer for 10 is C. Hyperactivity extends huge amounts of calories and interferes with caloric intake, thus resulting in rapid weight loss. So let's monitor that weight daily to protect the patient's physiological integrity. Question 11. What are the risk factors for bipolar disorder? You're almost there. I hope you're getting these questions right. A. Having a first degree relative, such as a parent or sibling with BP. B. Period of high stress, such as death of a loved one or a traumatic event. C. Drug or alcohol abuse. D. All of the above. Or E. A and B. It's D. All of the above. Okay, question 12. True or false? Bipolar 2 disorder is defined by a pattern of depressive episodes and hypomanic episodes, but not the full-blown manic episode that are typical of bipolar 1 disorder. True or false? It's true. Question 13. Which of the below treatment options are available as well for patients with bipolar disorder besides medication? Is it A, electroconvulsive therapy, B, transcranial magnetic stimulation, C, A and B, or D, none of the above? It's C, A and B. Question 14. Which of the below is an anticonvulsant drug that is also used for BP? Is it A, Seroquel, B, Risperidol, C, Carbamazepine, or D, Abilify? It's C, Carbamazepine. Question 15. The hepatic clearance of this drug is 0. Is it A, aripiprazole, B, lithium, C, carbamazepine, D, quetiapine? It's B, lithium. Question 16. A 56-year-old man diagnosed with bipolar disorder at the age of 36 after his divorce has had 3 manic episodes and 2 depressive episodes since then. The patient has been suffering from exertional angina for 5 years and from hypertension for 2 years. The present medication of the patient includes lithium, atenolol, lovastatin, losartan, and aspirin. Plasma levels of which of the following psychotropic medications were most likely determined periodically to assess the effective dosage and to avoid toxicity? Is it A, atenolol, B, lovastatin, C, aspirin, D, lithium, or E, losartan? The answer is D, of course, lithium. When in doubt, pick lithium on the test. But seriously, lithium is a drug that requires serum monitoring because of its narrow therapeutic index with serious toxic potential at high levels, and because individual variations occur in a dosing requirement. So, guidelines have varied over the years, but currently the recommendation indicates that plasma levels should be measured weekly when the therapy is started and until stabilization is achieved. Then it's weekly for 1 month and then at monthly intervals thereafter. What's this therapeutic window we want? Zero point 0.6 to 1.2. Question 17. A 28-year-old woman was brought to the hospital by her parents because she's been in bed most of the days for the last 2 weeks. She had an acute manic episode about 4 months ago and was discharged on Valproate with a good response. On questioning, she says that she's discontinued the medication 2 weeks ago because she felt she was cured. But she admitted that she's been depressed for some time now and she actually wants to die. Maintenance therapy was ordered. Which of the following drugs was most likely prescribed? Is it A, amitriptyline, B, mirtazapine, C, fluoxetine, D, venlafaxine, or E, lithium? The answer is E, lithium. The patient is most likely suffering from the depressive phase of bipolar disorder. The depression is often difficult to control, but patients at significant risk of SI, like the one in this vignette, is very much at risk. So lithium is the drug of choice and will remain so for long-term treatment of bipolar, especially with SI. Question 18. A 50-year-old woman suffering from bipolar disorder started a therapy which included lithium, 2 tablets daily. Which of the following adverse effects might likely occur during the first days of therapy? Is it A, edema, B, weight loss, C, insomnia, D, hypertension, or E, constipation? It's A, edema. Edema is frequently an adverse effect of lithium, especially during that first week of therapy, and it's likely due to the increase of sodium in the extracellular fluid, since lithium is not pumped out by the sodium potassium ATPase, and therefore it tends to accumulate inside the cell, thus displacing the sodium. You got this. Keep on going. You'll get an A. Question 19. A 57-year-old woman complained to her physician of tremor, polyuria, mental confusion, and disturbance of speech. The woman has been suffering from bipolar disorder and has been receiving lithium for 6 months. 2 weeks ago, found to have high blood pressure, started on antihypertensive treatment of hydrochlorothiazide and captopril. Which of the following was most likely the reason why she's experiencing these adverse effects? Is it A, thiazide-induced dilutional hyponatremia, B, decreased renal elimination of lithium, C, decreased hepatic metabolism of lithium, D, thiazide-induced hypokalemia, or E, captopril-induced hyperkalemia? The answer is B, The symptom of the patient indicates that she's most likely suffering from the adverse effects due to excessive plasma concentration of lithium. The patient was treated with hydrochlorothiazide, and it's known that the clearance of lithium is reduced by 25% by thiazides. This is because lithium is 80% reabsorbed by the proximal tubule by the same mechanism of sodium. So, when the body is depleted of salt and water, the enhanced reabsorption of sodium in the proximal tubule is accompanied by the enhanced lithium reabsorption that can lead to toxicity, which is what is occurring in this vignette. Question 20. A 46-year-old woman visited her physician complaining of fine hand tremor and of increased need to urinate. The woman recently was diagnosed with a psychiatric disorder and has been taking psychotropic drugs for 3 weeks. Physical examination disclosed cystic acne with folliculitis over the trunk and thorax. Which of the following drugs could have caused the patient's symptoms and signs? Is it A, fluoxetine, B, haloperidol, C, lithium, D, flufenazine, E, valproic acid, or F, trazodone? C, the symptoms of the patient suggest that she's likely suffering from the adverse effects of lithium. Tremor is an adverse effect of lithium that is dose dependent and can occur in up to 60% of patients receiving high doses. 21. A 24-year-old man was accompanied to the clinic by his mother, who stated that her son has been exhibiting the most unusual behavior over the last few weeks. He was euphoric most of the days, stayed up later and later at night, and frequently woke up his parents shouting and screaming. Recently, he experienced problems at work. Upon arriving at the clinic, he had trouble sitting still or listening and became increasingly irritable throughout the examination. He repeatedly said he heard a voice telling him he had a superpower. Which of the following pairs of drugs would most likely be helpful for this patient? Is it A, fluoxetine and risperidone, B, imipramine and lithium, C, fluoxetine and haloperidol, D, imipramine and haloperidol, or is it E, risperidone and lithium? The answer is risperidone and lithium. The symptoms and signs of the patient suggest that he's suffering from an acute manic disorder. Lithium is the drug of choice for bipolar disorder, since it reduces both the frequency and the magnitude of mood swings. However, it has a slow onset of action, taking as long as 1 to 2 weeks to fully exert its therapeutic effects. Therefore, an adjunctive medication is used during the first few days of therapy. Benzodiazepines are used for agitation and insomnia, but atypical neuroleptics are preferred when they are delusional or hallucinating, like this gentleman is. Question 22. A 44-year-old woman recently diagnosed with major depressive disorder has started a therapy with sertraline, but 1 month later, her condition has not improved. Her PMHNP decided to add a second medication. The NP ordered a drug with multiple mechanisms of action, including an inhibition of glycogen synthase kinase 3. Which of the following drugs was most likely prescribed? Is it A, bupropion, B, triiodothyronine, C, buspirone, D, lamotrigine, E, lithium, E, olanzapine? Once again, the answer is lithium. The two main proposed mechanisms of action of lithium are related to the inhibition of two signal transduction pathways, the inositol signaling and the glycogen synthase kinase 3 signaling. Question 23. A 43-year-old woman presented to the psychiatric hospital complaining of depression, hopelessness about her condition, sleep disturbance, and poor appetite. She had 7 previous hospitalizations for manic or depressive episodes and has experienced 5 mood swings in the past year, including episodes of depression and hypomania. Despite adequate plasma levels, she has not responded to lithium. Which of the following drugs would be appropriate for this patient? Is it A, Haldol, B. Thyrizine, C. Fluoxetine, D. Valproate, E. Amitriptyline, or E. Diazepam? The answer is valproate. The woman is most likely affected by a bipolar disorder resistant to lithium therapy. The patient experienced 5 mood swings in the past year, and therefore she meets the criteria for rapid cycling. About 70 to 80% of rapid cyclers have a poor response to lithium, so valproate and lamivudine are considered a useful alternative to lithium when the latter is not effective. Question 24. A 36-year-old woman complained to her PMHNP that she felt tired, suffered from constipation, and had gained weight in recent weeks. She also complained of feeling cold and of the absence of menses during her last 3 months. The woman has been suffering from a bipolar disorder and had maintained successfully on lithium therapy for a year. In addition to lithium, her present medications include cimetidine for duodenal ulcer and loratadine for her hay fever. Which of the following was most likely causing the patient's symptoms? Is it A, lithium-induced hypothyroid, D, cimetidine-induced decreased lithium metabolism, C, the side effects of cimetidine, D, essential depressant effect of loratadine, or E, worsening of the disease due to inadequate lithium dosing? It's due to the lithium likely decrease in the thyroid function in most patients, but few of them show the symptoms like she is. So the effects is due to the inhibition of the thyroid hormone synthesis. The mechanism of this effect is likely related to the lithium-induced inhibition of the adenyl cyclase, which in turn will inhibit the TSH-induced production of cAMP in the thyroid cell. So A is the answer, lithium-induced hypothyroidism. Question 25. A 57-year-old man complained to his physician that he has always been thirsty and has frequent and profuse micturition. The man recently diagnosed with bipolar disorder and has been receiving lithium for 3 weeks. Which of the following was most likely the cause of the patient's symptoms? Is it A, blockade of sodium reabsorption in the thick ascending loop of Henle, B, blockade of ADH-induced increase of cAMP in the collectin tubule, or is it C, increased glucose plasma levels, D, stimulation of the thirst center in the hypothalamus, or is it E, a blockade of vasopressin secretion from the pituitary? The answer is B, blockade of ADH induced increased by cAMP in the collectin tubule. Question 26. A 51-year-old woman was admitted to the psychiatric hospital because of depressive mood, feelings of hopelessness, and SI. The woman had a history of alternating episodes of depression and hypomania during the last 8 years. An immediate diagnosis of severe bipolar depression was made, and appropriate therapy was ordered. Which of the following pairs of drugs was most likely prescribed? Is it A, lamivudine and lithium, B, amitriptyline and haloperidol, C, amitriptyline and valproate, D, lithium and ethosuximide, E, lamivudine and ethosuximide, or is it F, valproate and haloperidol? The answer is A. Unfortunately, the history and the symptoms of the patient indicates that she is suffering from a severe depressive episode related to the underlying bipolar disorder. When depression is severe, 2 or sometimes even 3 drugs is appropriate to be on. Lithium remains to be the drug of choice for acute bipolar depression with a mean response rate of about 76%. The current guidelines indicate that the benefit of a combination of lithium plus an anticonvulsant is appropriate, such as lamivudine, valproate, or carbamazepine. Question 27. A 33-year-old woman has been maintained successfully on lithium therapy for 2 years for a bipolar disorder. Now she is planned to become pregnant. Her psychiatrist ordered her to stop lithium and to start another medication. Which of the following drugs was most likely prescribed? Was it A, carbamazepine, B, valproate, C, quetiapine, D, haloperidol, E, clozapine, or was it E, amitriptyline? The answer is C, quetiapine. Some anticonvulsants like valproate, lamivudine, carbamazepine, and some atypical antipsychotics such as aripiprazole, olanzapine, quetiapine, and risperidone have become good alternatives and adjunctive treatment to lithium for maintenance therapy for bipolar disorder. Among atypical antipsychotics, quetiapine has the lowest ratio of umbilical cord to maternal plasma concentration and does not seem to cause significant teratogenic risk to the fetus. Therefore, it's a rational choice for maintenance therapy in a pregnant woman with bipolar disorder. Question 28. A 46-year-old man complained to his physician of fine hand tremor, diarrhea, and a frequent need to urinate. The man has been receiving lithium therapy for 1 month because of bipolar disorder. Routine lab tests showed a normal renal function and a plasma lithium level of 3 milliequivalents per liter. Lithium has a volume distribution of about 45 liters and a half-life about 20 hours. How many hours should the physician withhold lithium in order to reach a safer yet likely therapeutic level of 0.75 milliequivalents per liter? Should it be A, 20 hours, B, 100, C, 80, D, 10, E, 30, or E, 40? The answer is 40 hours. Don't forget that the plasma concentration of a drug halves every half-life. So the plasma level will be 1.5 after one half-life. Therefore, it would be 0.75 after two half-lives, which is why the answer is 40. Question 29. A 34-year-old man was admitted to the psychiatric hospital because of an acute panic attack. The man had a first panic attack at the age of 27 and had 3 other panic attacks since then. A diagnosis of acute mania was made, and a therapy was prescribed, which included a drug that acts as a block in D2 and a 5-HT receptor in the brain. Which of the following drugs was most likely prescribed? Was it A, lamivudine, B, clomidopramine, C, valproate, D, olanzapine, E, lithium, E, trazodone? It was olanzapine. An acute manic attack often requires a treatment with 2 or 3 drug combinations, usually lithium plus an anticonvulsant plus an atypical neuroleptic. All neuroleptics most likely act by blocking D2 receptors in the mesothelmic and the mesocortical pathways. In addition, they also block 5-HT receptors, and this action may contribute to their clinical effects. Atypical neuroleptics like olanzapine seem to have higher affinity to the 5-HT receptors than the D2 receptors. Good luck on your test. Congrats. If you like this, please pass this along to your classmates, subscribe, and like. Oh, comment below if you have any questions or if there's some corrections that you think need to be made on any of these answers or anything like that. Thanks.